I'm Vanessa, and today I'm going to be doing a wet to dry dressing change using the sterile technique. I will begin by review my orders, and the order says to clean the dressing with normal saline wet to dry using the sterile technique. Go to the patient room, knock on the door, perform hand hygiene. Hi, I'm Vanessa. I'm a student nurse with Velvet State. Can you state your name and date of birth? Okay. I was looking at your orders, and the doctor put in an order to clean your dressing with normal saline using the wet to dry sterile technique. Have you gotten this done before? No? Okay, so what I'm going to do first, I'm going to begin by removing the dressing, and if I have to, I'll pour a little saline on the edges to loosen them up. And then I'm going to clean the dressing with some wet gauze, and they're wet with normal saline. I'm going to clean it gently, and then once it's clean, I also have to go to culture. And I'm going to do that by getting a Q-tip, and I'm going to swab it. And then I'm going to place some wet gauze on top of your wound, dry gauze on top of that, and then I'm going to top them both with an abdominal pad. All right, so are you in any pain? No. Do you have any allergies? Okay. So if the patient was in pain, I asked them to rate their pain on a scale from 0 to 10, with 0 being no pain, 10 being the worst pain ever. And then if I give them the pain medicine prescribed on their order, and I wait 30 minutes before I do the procedure. So I'm going to gather my supplies, and I'll come right back. And my supplies consist of gauze, an abdominal pad, Q-tip, tape, my saline, gloves, and my sterile pad. We're going to pick it up on the edges, step back, drop it, touch it only the corners. Shiny part on the bottom. I also disinfected my table before I done all this. Grab the corner of the gauze, open them, and dump. Well, this will be inside of here. And then I'll open it up. Dump it in the middle. I'll be putting this stuff in the garbage, but I'm going to put my stuff back in. And I have a flush, just in case I have to irrigate it. But we're not doing irrigation, but I'll open this and dump that on top of there as well. But in order for me to irrigate it, I will have a basin, and I will have the basin up under the wound, and I will start at the top and work my way to the bottom, squirting the saline on the wound. And then I will repeat it until the drainage is clear. And then I will dispose of the liquid in the biohazard container. And then I will get my saline, Check the expiration date on everything, and it's good. And I would lip it over the garbage can with my palm on the label. Then I will lip it, twisting it all the way around. And then I will post some over the gauze to wet those, and then top it back up. Forehand hygiene. Come back in the patient room, knock on the door, perform hand hygiene, ask them state and name, date of birth, verify the patient. But let the bed up to my level. Let the position of the patient comfortably. Let the head of the bed up a little bit. And then this is on the abdominal, so I will only expose the abdominal, keeping everything else covered, making sure the patient is comfortable at all times. So, I'm going to perform hand hygiene. Get my gloves. I'm going to take this off gently, okay? Let me know if I hurt you. And get up all the edges. I remove and assess it, and I'm going to assess it using Coach and Rita. So I looked at it, I'm gonna roll it up. So, not over the patient. Hand hygiene, and I will assess the wound with Coach and Rita. I perform hand hygiene. These are my sterile gloves. Open them up. Away from it first. Get the sides, never letting my hands touch the opening. And I'm right-handed, so I will blow my right hand first. I'm gonna get my 2 fingers up under the cuff, pick them up, step back. I'm gonna blow my dominant hand. My air is on and it blew that back. So now I will grab the cuff for that glove, pick it up, step back, and blow my left hand. Only touching the cuff of the glove. So now I have my gloves on. Now I'm going to clean the wound. Pick it up. And I will squeeze off excess saline. I will first wipe the middle dispose of that. The side away from me. And pinch it. Dispose of that. The side towards me. And dispose of that. And then I will get the culture. I'm gonna get the Q-tip. Swab it down the middle gently, and then I will put it in the container and set it to the side. Never touching anything and never turning my back on the sterile film. Now that I done cleaned it and I got the culture, are you in any pain? No? Alright. So now I'm going to dress it. Then I'm going to get some dry gauze and put on top. I'm going to top it with the abdominal pad, blue side up. Then I will tape it. Then I will get a tear. Another piece of tape. And I'll write my initials, the date and time on it. I did that. And I will place it on there. And then I will dispose of my gloves. Form hand hygiene. Cover the patient back up. Let the bed back down to the lowest position. Make sure they're comfortable. Call bell and reach. And clean up my dispose of everything. And my documentation will read the date and time, sterile, wet to dry dressing change done, patient pain level 0 before and after procedure, wound on abdominal, assess using coach and reader, wound edges well approximated with no drainage noted, peri-wound skin is dry and intact without swelling, redness, or odor. Old dressing removed gently. Wound cleaned with normal saline and culture collected, labeled and sent to lab. Wound dressed with wet gauze and abdominal pad. Dressing secured with cloth tape with label with initial date and time on it. Patient educated about procedure, bed in lowest position, call bell and reach. And this concludes my video.